So I'm coming at this from a little different angle. I represent patients and really want to solve this problem of the communication between the patient and the doctor and getting the information where it needs to go when it needs to get there. And so I'm not a medical person. I'm not a healthcare person. I come from a banking world. So for the past 2 decades, I've been building payment systems for Visa. I've been building digital banks in the Nordic regions that are using digital IDs and technology that is 10 years ahead of what we have here in the US. Really cool stuff, and I've been wanting to bring it here. And so that's been my professional background, and I just love building software, I love building businesses. The other reason I'm here is on the personal side. So in 2013, my son was diagnosed with a rare pineal brain tumor. And we, through circumstance and a little luck, we landed right here at Dell Children's. And Timothy George, Virginia Herod, their amazing team, saved his life. He's just passed his 10-year survivorship, and he's here with me today. Ford, raise your hand. This is Ford Holland. So the most important thing I have to say is just thank you. Thank you for being here in these moments. You make such a difference and such an impact. And the second reason I'm here is we want to give something back. Patients have something to offer. We can be an amazing resource for you now. And so I'll talk you through what we have done. And what I'm going to show you, while this is supposed to be about futures, we've actually built this. So I can give you a live demonstration next door. Everything you're going to see actually works. We are giving everyone here early access to it. I need you to test it. I need you to use it. Tell me what's wrong. We'll fix it and go from there. But it's coming out of the lab. We've done all that we can do. Now it's time to put it in the real world. So we are introducing a new concept called open healthcare. And this is a new world where patients are going to be your best resource to unblock care, to unblock research. This problem of how do we get data sharing to happen. Every speaker in the last 2 days have talked about we need data, we need data. And beyond data, you need consent. So the patients are going to be the key to this. So you know this slide really well, right? Anybody have these problems? All day, every day. So we've got to get you the data. We've got to get it to you in a form that is actually useful. On the patient side, we want to solve their problems too. You know, every visit starts from scratch. Nobody remembers anything about us. We fill out the forms again and again. That whole crazy thing, that needs to go away. We get 17 minutes of your expertise, at a time. It's not enough. We're not in control of our records. We're not in control of cost. We don't know what anything is going to cost us. That's a little bit crazy. Number one reason families go bankrupt is medical debt. And then finally, we are just passengers. We do not have the medical knowledge to understand what is a mixed germ cell pineal tumor and what is going to happen next, right? You get these terrible news. So we want to solve that problem. I don't want to be a passenger. I like data. I like being smart. I want to have meaningful conversations with you and know what questions to ask. I don't even know what questions to ask half the time. So in 2022, a miracle occurred. Open healthcare quietly became law. The government doesn't call it this, but this is what it is. We've seen this before. But essentially, they gave patients an amazing right, an absolute non-negotiable right to all of your data, not a little bit of it, all of it, in electronic form at no cost. Really, really powerful. But there's no infrastructure to do anything with it, right? How do you take advantage of this right? How do you exercise it? The second thing they did is provided a portability standard called FHIR. It says, so now we have a standard format. It's portable. You can use it anywhere. You can take it anywhere. Very important piece. And then we have an identity standard. If you're going to give patients this right to request their data and share their data and consent for their data to be used for research, everyone needs to be able to rely on the fact that that's the real patient, right? And so the ways we do identity in this country are not strong enough. The way we do it in the Nordic regions is high security, banking grade, digital IDs. If you ask a Norwegian or a Swede, what's identity theft? They'll cock their head and go, what are you talking about? They do not have this problem. What's a record mismatch? What's a patient record mismatch? What? What are you talking about? They don't have this problem. Fraud. Don't have this problem. We were doing 1 billion transactions a year with this technology, and we didn't have identity theft. We didn't have any scalable fraud. The only security attack that works is if I grab you by the neck and say, do this transaction, and we encourage you to say yes and do it. We can always get your money back. We can get your data back, but that's the one attack that really works. So this technology is really amazing, and we've also got the regulatory fines here. So now that piece is in place. So I've seen this movie before. In 2016, we pioneered open banking in Europe. So The situation over there was they had 4 big banks that were controlling everything, that were stifling innovation, blocking the startups that had good ideas. It's pretty bad, and they kept raising prices. So no innovation and higher prices is what they were getting. So the EU got smart and said, you know what, let's go give some power, some superpowers to the consumers. And so they gave them these 4 powers that we just talked about on the prior slide. So when I saw that, I recognized it immediately. This is the opportunity to open up healthcare and get this data to move, and the patient is the key. So we are now introducing Health Bank One. We intend there to be thousands of health banks. You can brand these, you can use them, you can customize them, make them your own. It is very much like the Visa platform. You know, every bank's got a credit card, every bank has got a little bit of different flavor, and that's what you can do with this, this capability. But essentially, as a new kind of bank, it does 2 things. It collects data on the patient, and then it shares intelligence, not just records. Nobody wants these records. I've tried to hand my son's binders to several doctors, saying, read in, I've got everything. I spent the time, I collected it, here you go. All the images too. And it's this, you know, step away. Nobody's got time for that. So the intelligence is what you need, that's what you're after. And then the key really here is patient consent. I am a free agent. I'm not a covered entity. I am never been asked to sign a BAA. I can do anything I want. So now you can start thinking of data, your personal data, as money, right? I can put it in the bank, we keep it safe, and then I can move it. It's accessible to me. I can use it on my credit card, I can do wire transfers, all kinds of ways that I can move that money wherever I need to do it around the world, instantly and securely. And so now you can think of health data as being in the same. It's just zeros and ones, and we've taken the digital banking platform and adapted it to this technology, or to this industry. So you can think of this as a, you know, automated real-world data collector. It's a giant defracker, right? All this data is in all these nooks and crannies. You can't get at it. It doesn't make any sense. It's in terrible form, terrible shape. So now the patient can order their records from any provider, any lab, any pharmacy, and we will get it. We have a 100% success rate in getting the data. We don't care how big or bad your institution is. We don't care what EHR you have. We don't care if all you've got is a fax. We will deal with it. And so we've built these pipelines that can intake structured data. It can intake unstructured data from a PDF. We are getting images. Images are important. That's the #1 thing we need for my son. So I was not going to build a system that doesn't support that. But now you can get the data from anybody, and we consolidate that, clean it up, and I'll show you what that looks like, and then bringing AI into the picture. So we're not an AI developer. We are a platform that can securely deploy, distribute, and make AI accessible, make it safe. So we hope that you build better AIs, right? There's still some challenges, but everyone in this room is working on that. So we are AI agnostic. Today we're using GPT-4o because it's the gold standard. It works pretty well, and we're not doing diagnosis here. We're just trying to get information where it needs to go, get it cleaned up, and so forth. And then everything is wrapped in banking-grade security and privacy, which is badly needed in this industry. So the thing the pipelines do is data comes in, we normalize it, and then code and structure this data. So you've all seen this text that you see every day. That's what you get. We take that, and we normalize it, we code it, and then we map it to all the coding systems. So SNOMED, ICD-10, LOINC, on and on. So we have done this not by ourselves. We joined with a company called IMO, which are they're the coding gold standard. They build the coding module in every single EHR, right, including Epic. So we spent 2 years building this pipeline to be able to take FHIR data when it comes in, get it cleaned up in this form, be able to take PDFs and go from a PDF to FHIR data. It's pretty amazing. So I'll show you a couple of screens. We can do a live demonstration for you next door if you want to come see it, but this is real software. And so here is a view of the portal that's available. This is all driven by API, so you can get at it that way. But the data that you'll find when you pull data from the patient's bank account will be structured. It'll be beautiful. It'll be clean. It's ready for analysis. It's ready for AI. It's good stuff. But even with all that data there, you still don't have time to go through it all, right? We're working with research organizations, working with providers, and the time challenge of how do you go through this, particularly with a complex patient, and get what you need. So we've integrated CareGuide here, and we're giving it access to all this data so it can do these first screens. And so the analysis, something very simple, like I just want to get a patient summary, ground me in what's going on. You can now ask CareGuide, and it will give you a full review of systems. right? Here's the demographics, here's what this patient is dealing with, here's the medications, whatever you want, and you can customize these things. But now you're getting intelligence really quickly in seconds. We also want to give this capability to patients. So this one's a little scary. What if we gave patients access to this AI? They already have it, right? Patients are already using GPT to ask questions, but it's not personalized. GPT doesn't have access to my medical records. So what if you combine those two things and now you could have personalized medical intelligence? That would be powerful and start solving problems again, where I can now have the knowledge that I need to know what to do, where to go, what questions to ask, all these kind of things. So that's built into the mobile app. And I'll give you another story that's quite personal. So my colleague, Jason Cho, who's here today, you may have met him in the opening night, his daughter was diagnosed with trisomy 18. His doctor, her doctor, Julia's doctor, is Dr. Frazier. So many of you know Dr. Frazier. And so Dell Children saved my colleague's life, his daughter's life as well. She just turned 8. It is an amazing success story. She's an absolute miracle and a joy. Yeah. So the Cho family was really excited. They're going to have a baby. It's going to be a girl. This is going to be wonderful. And then they got this news. And you'll see there's 3 little marks that don't make any sense to me over there on the right. But they did the genetic test and they found she's got 1 extra chromosome. And so described this to the Cho family. They black out just like I did when I got my son's news. You know, I just, oh my God, what is this? Never heard of this. And so this is what they left the doctor's office with, this piece of paper. So they go home and they've got 1,000 questions, scared to death. The 17 minutes is up, you know, and now they're sitting there with this piece of paper. So now they can just take their digital ID, add this as context to GPT and ask it, what does this mean? And just go and go and go as deep as you want to go. And it provides really good information. Again, we're not doing diagnosis here. This is helping people understand in the communication. And so now even things like, you know, what questions should I be asking about this? I don't know. GPT will give me a very good set of questions. It will create an agenda for my next visit. So my hope is that we show up a lot smarter, a lot more informed, and we can have a much more meaningful conversation that hopefully you will enjoy. It may be a little scary, but this needs to be in the hands of patients. I went back and used this on my son's records from the very first day, the very first bits of information, the very first lab test, the CT scan, and I walked back through that journey with this app in my hand versus how I did it before, where we had no resources. His tumor occurs most frequently in Japan. I don't read kanji characters. I don't know that. Plus, I'm not medical. So I spent a little time trying to figure out the people who know the most about this condition, and it was totally inaccessible. But now I've gone back through it, and I know exactly what they're doing for trials for folks with this condition, with germ cell tumors now, right? There's a lot going on there that's not going on here. So this is a global opportunity. Once Julia, you know, was born, she survived, she got stronger, and at about age 2, it was time to do the heart surgery. So this is a handiwork, this is a sketch from Dr. Frazier. So they had the surgery, and Dr. Frazier sat down and spent a good 40 minutes with him and said, you know, it went well. You know, we're not out of the woods, obviously. This is complicated, but, you know, it was the surgery of success. So let's go from here. And he told them a whole lot of other things, which they couldn't hear, right? Just, oh my gosh, she lived. So now this is what they got. And it had all these notes that didn't make any sense. And they stared at that at home, and it was another few weeks before they got to talk to anybody again. Now they can load that in here, ask the question, what does this mean? And it will actually translate that image. It's got vision, does a really nice job of explaining all these terms that are so foreign. And the last piece is now I can ask it to, you know, simplify this for me, right? Tell me in layman's term. Tell me at a 6th grade. The Cho family has members of the family who do not speak English, speak Chinese, Mandarin. And so grandma was really worried, and none of this was decipherable for her. Again, now just translate this in Chinese. Now the family can start understanding this across language barriers. And I know you deal with this all the time in your clinics and in the hospital. How do you explain these things that are complicated to your patients? So that really is it. Again, my ask is that you try this. Tell me what's wrong with it. Help us manage the risks, the hallucinations, these problems that are there. And please build better AIs for us that don't have those problems. But I think today it is more important to get this in the hands of people. Patients will be your best resource. Everybody who needs data Stop going to the B2B schemes. They don't work. Start asking your patient, hey, let's get this data for you. You've got the right to it. We can get it. There's no more mother may I. That is over. That's it. Thank you.